Welcome all to another episode of HomeoMitra Vartaalap. We have with us today Dr. Khyati Ashara. She is a homeopathic doctor as well as a nutritionist, and today's topic is going to be about infertility and nutrition. But before we start the topic, let us know something about Dr. Khyati. So, if you could tell us that how long have you been practicing, and being a doctor, how did you get into nutrition? Because I know significant practice of yours is into nutrition.
Yes. So I have been practicing since last 14 years and I went into nutrition in around 2020 during lockdown. And the reason being that being a doctor, we have always been that, I have a diabetes, तो क्या खाना चाहिए? Blood pressure है तो क्या खाना चाहिए? फीवर में भी लोग पूछते कि क्या हम ये खा सकते, क्यों नहीं खा सकते? So for that reason, I thought that nutrition will help, preventive measures, holistic approach, and obviously also being a doctor you have an advantage that you know most of the stuff, and it's just an added advantage that being a doctor you're also a nutrition coach. That is why I thought that this field will always be better along with homeopathy.
Does it work along now? See, this is a question not particularly for patient, because I know I'm asking this from a point of view of a doctor, that when a patient comes to the doctor and you tell them कि भाई ये nutrition भी साथ में लेना है, do patients accept that as part of the treatment?
Most of them, yeah, they do. Like, when you have fever, we say garam garam raab piyo. Yeah, when you have diabetes, like what should you eat except from being sugar? Is it rice also which affects your glycemic index, or fruits which affects glycemic index? So it does. People do listen to. Being a doctor, I think that puts a more weightage as a nutritionist also.
So this is good to know. Now, for doctors who are going to listen to this, please mention in the comments where if you have faced any challenges when providing nutrition advice to your patients. And patients, general people who are going to listen to this, please tell us if the doctor is also advising you nutrition along with the treatment that they are giving to you. Okay. Now, before we dive deep into the subject of infertility and nutrition, let us first understand, Dr. Khyati, that why is it so important, food, nutrition, in today's world particularly?
So today's world, nutrition is a very, very important aspect, because we do not have that kind of time to follow certain lifestyle. I think every disease that we are facing today is because of the lifestyle diseases or stress induced diseases that we are facing. So this becomes very important because nutrition overall helps you to also give you positive energy, also helps in preventing certain diseases if you follow from your childhood. So I think nutrition as a whole is very, very important in your lifestyle modification today. Everyone has a sedentary lifestyle. You go home, you are sitting on your couch and either seeing your TV or your mobile, or you go to your office where you have 9 to 5 job, you're doing the same thing. So there is no time for exercise. People want quick results, so eating junk food because that is what is quickly made, so forgetting your old nutritional stuff. So nutrition in today's world becomes a very important and aspect of your life. So
what I understand is that medicine के साथ अगर nutrition हम use करें तो I mean it is a must. I mean nutrition के बिना नहीं हो सकता है. I mean we just take medicines, it doesn't work. We just change our lifestyle, it doesn't work. Nutrition has to be
an important part. Yes.
Good. So now that we have understood the importance of nutrition in day-to-day life in general, we will now get into the topic of infertility and nutrition. So why do you think is that nowadays, and it is quite rampant, that it is very difficult to get pregnant? Couples are not having children.
Yeah.
Why is it happening?
So there are some couples who obviously do not want it by choice, and there are some people who are facing issues probably because getting married very late. Even after getting married late, people don't want to have kids immediately. Obviously, it's financial issues, and people want to have a well balanced life before planning kids because they want to give their best to their kids. So planning late, conceiving also very late. Thirdly, your lifestyle disorders, your stress levels is at a peak. So these all factors are now probably the most common cause of having infertility. Also, hormonal disorders, like out of 4 women, 3 women have PCOD. Not necessarily they have issues, but this is one of the most major and common cause of in a hormonal imbalance, which can lead to infertility.
So this is PCOD, I understand this is regarding females. Anything in particularly that is affecting males also?
So
For-
males, they say that because you use your laptops very commonly, putting on your lap, or your exposure to that radiation also causes low sperm count. So one of the reasons, also stress affects your sperm count in some other way. So that can also lead to low sperm count.
Good. So I think we have now comprehensively understood why both sides are having that kind of issue with conception. Now, are there any foods which can affect, like any deficiency or any kind of vitamin deficiency that can affect fertility?
So the most common causes that helps in fertility, which if deficiency obviously leads to infertility, is vitamin D. Vitamin D helps in regulating your ovulation. Also, folic acid, very important. If you know, people, we advise folic acid even for people who are planning, because if there is deficiency of folic acid, it can lead to neural tube defects. Vitamin B12, because it is leading to ovarian dysfunction. Also vitamin C and vitamin E, because they give antioxidants to every cell. So any deficiency in this can cause infertility. So it is important to have your parameters checked, and obviously take supplements for the same. There are certain foods which is rich in vitamin E, and one of them is sunflower seeds, very much on Instagram and YouTube that you'll be seeing, because that is a good source of zinc, selenium, and vitamin E. Very important if you are, planning, and it boosts your fertility levels. So it's good that way.
So what I think we know now that it is basic foods which can provide vitamin E. I mean, even if the test is not available, you can safely take this food. There is not
Yes.
going to be any kind of an overload
No.
into the body. So that's good. Um, what are the signs of poor egg quality? How do we know that, before, let's say you take up a consultation, and
Yeah.
how do you ascertain that the quality of egg is, see, for sperm count we know that there is a proper test and all that, but
Yes.
for egg quality, how do we figure
So
out?
generally, if you have irregular periods, you have repeated miscarriages, you have low follicle count, your AMH levels, that you come to know through your blood test, that is mullerial hormonal tests, that all, if it is low, it can detect that your egg quality is not up to the mark. But there is a good news also, that if with proper diet, with proper exercise, your AMH and all can be saved. Obviously, it will not go back to the levels that we expect, but you still have a good chance of conceiving. Your follicular count, your should be more than 10 follicles in both the ovaries. That is how you come to know that the person has still good chances of conceiving.
I believe there are tests for these follicular counts also. There are specialized tests which can be advised.
No, there is an ultrasound that you do, and
Okay.
people can check your follicular phase levels.
Okay, I think that is quite useful. How many of you have heard of this test so far? Let us know in the comments. I have heard of this myth, or I'm not sure, that there is a certain age beyond which getting pregnant becomes difficult, like after 30 and all that. So is that really true? Because we have seen in our past that women in their 30s, late 30s, even early 40s, they get pregnant. But nowadays we don't see that kind of
Trend. So AMH, every woman when they are born with eggs. So as you age, your egg reserve gets depleted. So also beyond that egg reserve, your quality and quantity both are important. So the quality hai, quantity hai, but quality nahi hai. Like, then it is still difficult to conceive. Why is there no quality? Is all related to your nutrition, because stress levels, not eating on time, having junk food, these all are contributing factors for low AMH also. So it's not that people have not conceived, but yeah, the chances as you age reduces. Pehle ke zamane mein people used to not plan, getting married early, having kids early,
Correct.
and then people were settled. Nowadays we are planning everything at certain levels, which is not wrong, but yeah, it also has a disadvantage with your fertility levels.
I understand that now you have a specialty in nutrition. So how should one know, or when should one visit a nutritionist for a problem like infertility and also otherwise?
I think whenever you have some lifestyle disorders, it should be first to your nutritionist, because they can guide you and help you in whatever subjects that you are lacking or you have some blood pressure issues, तो अब हम डैश डाइट देते हैं, या अगर ब्लड प्रेशर है, वी नो व्हाट डायबिटीज है, सॉरी, सो वी नो व्हाट शुड वी गिव यू. एंड इवन विथ फर्टिलिटी कमिंग ईयर, तो क्या खाना चाहिए, क्या नहीं खाना चाहिए, सो दैट वी आपको issues ना आए, that all can be helped through a nutrition or through a proper diet. So holistic approach is such that eat a well balanced diet. Okay, carbohydrates, proteins, fats, minerals, vitamins, everything has to be in proportion. So what Indian diet में क्या होता है, we have more of carbohydrates, very less proteins if you are a vegetarian or a vegan, and we don't give importance to more minerals and vitamins because वो तो hardly खाने में आता है. So I can just guide you with certain, I can just give you a few tips just to boost some fertility levels. Is like beans and pulses because they are high in fibers and proteins. Sunflower seeds, as I told you, is the root source of vitamin E, zinc, selenium, all very important for your fertility. Okay, vitamin D, you have to, there is nothing else you can do except taking sunlight or taking supplements. Fruits like berries are very rich in antioxidants. Avocados रहते हैं which are a healthy fat and obviously good source for your fertility. Yogurt is good source of vitamin D as well, and also is antioxidant, so helps you with your fertility. So you have to also stop smoking, stop alcohol, no tobacco at all, eat a well balanced diet, take vitamins, take folic acids. If you are planning, your vitamins should be checked and should be at a proper level. Also, no stress, rest, relax, do yogas or any exercise is very wonderful and beautiful for your infertility. So अगर किसी को PCOD है, even if you lose 5% of your body weight, we say that you have a good chance of conceiving. So when you go to see infertility specialist and you want to do IVF or some IUI, if you are overweight or you are underweight, they will first tell you to come back to the normal weights and then we proceed, because there are chances that if there are 40% chances of conceiving through certain treatment, वो उससे भी कम हो जाता है because of your weight. So we have seen people going to infertility doctors and then coming to us saying, doctor, I have to lose weight to conceive, and then we have to give them a plan so that वजन कम कर सके.
So this is interesting. She has given ample amount of advice for nutrition in general for infertility, but please don't take it as the final advice. You need to consult the doctor because everyone requires a personalized diet, if I'm not mistaken. And sometimes what food might suit you, might not suit you, so you have to do that. And there is a lot of more content that she has posted on her Instagram handle, which is Health Station. Do check that out. And it's not just about some Western nutrition. She has the good part about, or the unique part about her handle is that she has included a lot of Indian foods. So that is something which you would really learn from, and you can put it into your daily practice in life. When should another doctor, someone who, let's say you are having a specialty in nutrition, but if someone else who doesn't have a specialty in nutrition, when should they know how and when to refer to someone who is a nutritionist?
I think it should always be the other way around. If you need a lifestyle modification, like you have hormonal issues like PCOD hai, या फिर you are very overweight or you are underweight, so then first come to a nutritionist and then refer to a doctor. And if there is someone who refers to a doctor and they know that this person needs lifestyle modification, then they have to refer to a dietitian or a nutritionist and then go ahead. So I think vice versa bhi ho sakta hai. So
okay, so there has to be some sort of a mutual understanding, knowledge also, and like it is a very simple thing that let's say in simple example, if there is a plumber, he is going to repair the pipe, but the plumber is not going to be able to do the electrical work. So similarly, everyone has their own specialty, their own knack, and therefore it is always good to have a mutual reference so that ultimately the patient benefits.
Yes.
Okay. Before we conclude, I would like to learn from Dr. Khyati if she could share some experiences from her clinical practice. Of course, this is without naming anyone to ensure that there is confidentiality. Something about cases, if you could share some experiences, anecdotes.
So nowadays I have seen a lot of females very young, in their 20s having low AMH. Reasons nobody knows. Like we don't know why a 25 years or 26 years should have a low AMH. So what we do, we generally give them diet where, we give them rich antioxidant foods, because every cell we know that needs oxygen.
Correct.
So even your pelvic areas, your eggs, your sperms, everything needs proper oxygen to mature, So then we give them diet which are rich in antioxidants. Obviously, if you have weight issues, we give them diet to lose weight. But if you only have low AMH with proper weight, your BMI and everything is fine, then just certain foods and certain things which help your egg quality and quantity to improve. That's what we do. Also PCOD, along with homeopathy, I have to give them. It's not only homeopathy which is going to help in PCOD. We all know that, being a doctor. So along with PCOD, exercises like high intensity exercises, yogas, and obviously not to take stress, and your diet. If you lose weight, 5%, if you're overweight, then you can obviously come over your PCOD is many times reversible, and we have seen with homeopathy, with nutrition, that your PCOD has become reversible.
If I can now sort of understand, is that your practice is a mix of both homeopathy as well as
Yes.
nutrition, but
Yeah.
at the same time you also provide a separate advice for nutrition if, let's say, someone doesn't want to take up homeopathic medicines.
Yeah.
Are there any differences between homeopathy plus nutrition versus only homeopathy or only nutrition?
As such, there is no
Experientially, I'm
difference.
asking, of course, not from research point of view, but in your experience.
No, so people generally, if even if you being a doctor, even you're practicing, there are people who will come and say, "Doctor, क्या खाना चाहिए, क्या नहीं खाना चाहिए." So this just becomes an added advantage. So there are certain diseases, like even when you have skin issues, we know eczema है या कुछ है. So we have anti-inflammatory diets, which along with homeopathy helps to reduce your inflammation in your body, and helps in reducing your skin, any dermatitis or skin disorders that you have, hormonal issues like PCOD. Alone homeopathy is not going to help you. तुम खाना खा रहे हो, तुम overweight हो और तुमको PCOD है और तुम सिर्फ homeopathy ले रहे हो, it might not work completely. So along with this, we need to give you nutrition, diet, or even recommend you. People don't want to take nutrition, so we just recommend, अच्छा ये खाना मत करो या ये खाना जाओ. We know lactose intolerance में क्या देना चाहिए, क्या नहीं देना चाहिए. So same way we provide with certain hormonal issues. So people are welcome with whatever it's their choice. We can't force them to do anything. Like there is a person who has PCOD and she only wants to do diet, but I know homeopathy will also stimulate it. But when the person says, or the patient says, I do not want to do it, then we can't force them. We can just make them understand, and leave it to them. That's all.
I think this is a very good approach that Dr. Khyati is having, and therefore I think, at least personally, I would always want to recommend patients for Dr. Khyati when it comes to nutrition in these specialties. Dr. Khyati, before we conclude, if you could send out a message to everyone, whatever you feel is best for them, any kind of things, that any simple advices that they need to follow, anything that they need to be mindful of.
Very basic and simple advices that we all know, that we all have to follow day to day: stop taking a lot of stress. I think it's a world of being stressed. We are stressed about very small things. We are stressed about anything and everything in today's world. Secondly, eat a well balanced diet. Eat it on time if you have that much. Just remove certain time from your daily hectic schedule and have your meals on proper time. And thirdly, relax, enjoy, and exercise is very, very, very important in today's world. Even a simple walking for 15-20 minutes, is more than enough. You have to walk 8,000 to 10,000 steps. As we are approaching 25, I think let's take a motto of being healthy and being without any stress or very little stress. I can't even say without stress because वो बहुत difficult होता है, but yeah, no stress or very, very, very little stress. And mindful eating. I think these three mottos and we are good to go, leading a healthy lifestyle.
Thank you, Dr. Khyati. That was a wholesome advice. It is going to be helpful for everyone who's going to listen to this podcast. Please share this with your near and dear ones, with your friends, with your family, with your colleagues, because at HomeoMitra Vartaalap, we ensure that the guests who come, they always add some value to your life in terms of knowledge, information, and especially a lot of healthy diet tips and healthy living tips. So thank you once again, the audience. Thank you, Dr. Khyati.
Thank you
For being part of HomeoMitra Vartaalap. Stay tuned and we'll come up with yet another episode of HomeoMitra Vartaalap soon. Thank you.